I want to start this film by stating that some of the footage contained that will follow will show scenes that show the base of a male's genitalia. This footage is not intended to be sexually explicit. It is intended for medical educational value and is not intended to be controversial. However, with that being said, I'm going to give a moment, a few seconds now, for the viewer to exit this video if you think that that kind of material is inappropriate or if it may make you feel uncomfortable. Does your skin look like this? Or have you seen skin that looks like this? By the time we finish today's video, you'll be able to recognize genital warts, sometimes known as condyloma, sometimes called HPV infection. HPV infections or genital warts is caused by the human papillomavirus. The most usual means of transmission is considered to be sexual contact. However, this is not always the case. Sometimes a patient can be infected by indirect contact from an object that has virus particles on it, or indirect contact from human contact. For example, if someone shook hands with someone with HPV, they could theoretically later go use the restroom and inoculate their own skin or genitalia and cause the viral eruption. This is done obviously without having had any sexual contact with the person at all. You can see in this video footage there are some pellet-like skin lesions seen on the base of the penis and the scrotum area. The most usual way that dermatologists go about destroying these skin lesions is with cold liquid nitrogen spray. Liquid nitrogen is 190 degrees below zero, and usually the spray is dispensed directly on the skin lesions, forming a significant amount of frost, destroying the tissue. I don't like liquid nitrogen as a method of primary destruction, even though it's felt to be a standard of care. In real life, it often causes skin lesions to multiply. Sometimes it causes skin lesions to spread to nearby areas. Therefore, I don't like it as a primary means of destruction. What I do prefer, however, is to numb the areas. In other words, to very superficially stick the areas, making them nice and numb. After they have become numb, I actually use a electrodesiccator to cauterize or cook these areas, turning them into crusts that will fall off in forthcoming weeks. I don't like using liquid nitrogen primarily, but after 2 weeks of wound healing, after destroying them with electrodesiccation, I would freeze the areas or dispense cold spray to freeze those areas while they are undergoing successful wound healing. The other things I would teach the patient to use at home would include topical use, and this is immediately after destruction, the way I described. Topical use of hydrocortisone 2.5% lotion, along with a tretinoin 0.025%, that's a vitamin A derivative often used for acne. But I like its use in this scenario because it helps to cut down on keratin formation and thus cut down on the tendency for recurrence of these skin lesions after they have been destroyed. The other thing I teach the patient to use is imiquimod. Imiquimod is a compound that's FDA approved to attack and kill the HPV virus. I'm Dr. David Bryant. I'm the proud owner of World's Famous Dermatologist, a dermatology practice in Stockbridge in Decatur, Georgia. We help patients from all races and ethnic groups, but we're probably best known for our expertise in Black skin. The dermatologist that you go to and trust does not need to be a Black American like myself to be qualified to work on Black skin, but whoever you're trusting with these kind of conditions should have experience with a large volume of Black patients and be very experienced with skin conditions that affect darker skin types. I hope you enjoyed today's video. If you did, please like, comment, and subscribe to the channel. Please leave your comments below. I will consider your comments and questions the next time we cover similar content. I look forward to connecting with you on the next video.